While delivering an update on the COVID-19 situation in the country and presenting new guidelines for the prevention of the pandemic, the Minister of Health, Dr. Ruth Jane Aceng, said that the country's number of COVID-19 patients currently stands at 2 severe cases and at a positivity rate of less than 2%.
A massive drop in the number of admissions at the health facilities. Currently, there are 2 severely ill COVID-19 patients on admission at Mulago National Referral Hospital and St. Mary's Hospital, Lacho, with a positivity rate of less than 2% since February 2022.
After 2 years of the COVID-19 pandemic, characterized by full and partial lockdowns, mandatory tests and vaccinations, the country found a sigh of relief in January when the president opened the economy. And now the Minister of Health has even further eased the restrictions. Addressing the media at the Media Center, the Minister of Health, Dr. Ruth Jane Aceng, has confirmed the suspension of the PCR test requirements at entry points of the country and a few other restrictions.
Requirements for COVID-19 for negative PCR test done within 72 hours pre-boarding for all incoming travelers is suspended with immediate effect for those who are fully vaccinated. Fully vaccinated individuals will not be required to wear face masks when they are outdoors, provided there are no crowds.
With the country's vaccination rate standing at only 22.1% of the total population that has been vaccinated against COVID-19, Uganda still falls far short of the World Health Organization's requirement of 70% vaccination. And the minister says vaccination effort will get a new boost with renewed government funding for the purchase and administration of vaccines.
Right now, we have 5.4 million doses in the country. We are expecting another 5.8 million doses, giving us about 11 million doses. It is not adequate to vaccinate the children, not even adequate to finish the adults who need a booster dose and continuation of vaccination.
And as vaccination efforts take a new twist, pupils and children are the ministry's target ahead of the second school term later in May.
The Pfizer vaccine, approved for use in children, will be deployed to vaccinate the age group of 5 to 17 years. Vaccination of this age group, 5 to 17, will start as soon as the second term of school commences on the 9th of May 2022.
With a positivity rate of less than 2%, Uganda's fight against the pandemic is already considered a success story. However, there are 2 new threats standing by the doorway. First, Ebola from across the border from the Democratic Republic of Congo and the yellow fever outbreak that has been reported in Wakiso district. According to the Minister of Health, the threat is not as close as it appears.
Nearly every year, we report cases of yellow fever. And so 3 years ago, WHO said Uganda is endemic for yellow fever. And the only way to address yellow fever outbreaks is to introduce the yellow fever vaccine into the routine vaccine so that everybody is vaccinated. And we have already gone ahead and applied, and hopefully we shall have the vaccine introduced next year.
Robert Ndiamhachi for BTM News Today.